Hey, I'd like to welcome you to another episode of Mission Matters. My name is Adam Torres, and if you'd like to apply to be a guest on the show, just head on over to missionmatters.com and click on Be Our Guest to apply. All right, today I have Ron Belldegrun on the line, and he is CEO and co-founder over at ByHeart's. Ron, welcome to the show.
Thanks for having me, Adam. Looking forward to it.
All right, Ron. So I'm really excited about today's interview. I've done a lot of interviews in my day, Ron, so over 6,000, and this is the first one. I've done things definitely on raising children. I've done things in the industry from many different angles, but this is the first time I'm talking about infant formula and raising the standard, which I'm excited by. If I can get a curveball, not in a bad way, but just, something new, I'm excited for me. I'm excited for my audience. First thing I got to know, Ron, is how'd you get into this business?
Yes, I get asked that question a lot. Yes, look, as background, ByHeart's a next generation infant nutrition business. We make infant formula. After 6 years of development, we launched as the first new infant formula manufacturer in over 15 years. And the formula is now available across e-commerce, Amazon, and about 12,000 stores. And look, for those who don't have kiddos, infant formula is the sole source of nutrition for babies in the first year of life. So if one doesn't breastfeed, this is the only other suitable nutrition. That's true of about almost 80% of parents in the country. So this is literally the food that sustains life during the most important times of development when all of baby systems are developing, right? And yet, the same three companies have dominated for decades and the products haven't changed much and they feel quite far from breast milk. And parents often, share that they feel they're kind of compromising during this most important decision we make as new parents. In fact, I started the company with my sister. She had just experienced the category with her then 1-year-old, who's now 9 or 10. And personally, she experienced the kind of category and the lack of clarity and outdated recipes and how overwhelming it is to make decisions. I had a background in life science, so I had been immersed in this category for over a decade. I was studying breast milk science, and I knew the category actually didn't need to be this way. I had actually never seen a more exciting time in nutrition science and breast milk research. We understood more about breast milk than we ever have. All the tools were there to make an infant formula parents could feel great about. It just requires taking a very long and tough path to actually innovate in this most highly regulated food in the world. But, we were committed to doing it, and we spent the next 5 years building ByHeart from the ground up, investing in our own factories in Pennsylvania, Oregon, Iowa, and sending a team of medical experts, running the largest clinical trial in 25 years to really create a product we could be proud to feed our babies. Because for me, it was as personal as it was professional, and it became that throughout our journey. Because when I started the company, I didn't have kiddos. But today, I have 2. I'm a dad of 2 and had a ByHeart customer of my own and was really navigating kind of the journey myself. And I actually love that by feeding infant formula to my children, I could actually get in the game on feeding time, especially at nighttime. And so that actually played a very important role, I would say, in my relationship with my 2 kids.
Wow. Is that a write-off, their product test? No, I'm just playing. Don't answer. I'm doing testing with the kiddos. Just playing. Don't answer that. But I want to take a step back and stay in the early days of this. Like when you were doing your research and when you were looking, I don't want to assume here because what are some of the things that stuck out? What was the opportunity where you were like, okay, this is ready for, you're not using the word, but I'm going to use it, disruption. And maybe you had a different word, but you saw a real opportunity here. What was some of the things that the current industry was lacking that you felt you could provide some value at?
Look, I started the company with just deep frustration from understanding the big disconnect between, on one side, it was the most exciting time in breast milk science. We understand the components of breast milk that drive its benefits that are critical to developing really the future of health that starts with the source nutrition. And so there was so much advancement and so much excitement from the medical community. But then this category had really been largely the same for decades because it was dominated by just a couple companies that had, owned the majority of the market for 100 years. And every new entrant actually into the category in the last 20 years had all kind of taken the same sort of expedited approach, which is if you go to the one and only contract manufacturer in the country and you stay the same as their recipe from 15 years ago, then you can actually skip the 5 years of work required by FDA to bring a new infant formula to market, clinical trials, animal studies, a full submission. The problem is you can't change anything, and you're kind of referencing 15-year-old science, and you're kind of putting a label on a can. And so by understanding that background from my kind of time in this category, it became clear kind of why the category was the way it was. And my sister came into this experiencing it as a parent saying, when I go to the retail shelf, no matter what I grab, it feels like I'm compromising because I'm deciding, do I want the one for easy digestion, or do I want the one for brain, or do I want the one for the ingredient for, whatever other benefit, or do I want a clean ingredient? And at the end of the day, parents want it all and deserve it all. Breast milk doesn't come in 100 different flavors. It comes in one formula that is the most natural, but also the most functional nutrition in the world. And so we saw a real path to bringing the world's experts together under one roof to really study every component of breast milk, bring under one roof manufacturing, direct ingredient sourcing from really highest quality ingredients that we hold to the highest standards, a real willingness to actually bring the latest science and run major clinical trials. And it was a long haul, but we felt the only way to really create a differentiated and a product that parents could feel really good about because, this is the first decision you make as a parent, right? Like, what am I going to feed my baby? It is a really intimate decision, and that should feel great when you choose. And we should ensure that that nutrition needs to work harder than any nutrition in the world because it's setting the future of health. So those are really some of the things we saw. And it's not a category for the faint of heart. It was ambitious to say we're going to build all of it from scratch, but that's what we had to do to create the product we wanted to create.
Man, what an amazing story. This is just wonderful. I want you to go further into that. You said it, but I want you to go just a little further. Just that concept of science first. Like maybe I'm putting words in your mouth, but it seems like you have a science first approach based on everything, the way you present this. Like everything started with science, you're doing studies, everything started with that. Like, can you go a little bit further into that?
Absolutely. Breast milk is the original superfood, right? And it's not.
Never thought about that. You're right. That's a mic drop. You're correct. God made. There we go. Go ahead. Continue. This is great.
Exactly. Imagine
that's going to be the title of this episode, Ron. Just so you know, breast milk is the original superfood.
Exactly. Well, that's all we talk about here at ByHeart. It might as well be tattooed on my forehead. But in honesty, imagine like over our time as existence of humans, breast milk has evolved to deliver very, very specific nutrients, very specific proteins that are in literally the first sip a baby takes in colostrum that are there to, first of all, be really easy to digest and well tolerated, but also build the immune system, build the gut microbiome, set the future of health. These proteins were largely missing from infant formula until we developed our patented protein blend that for the first time brings the two most abundant proteins in breast milk, alpha-lactalbumin and lactoferrin, to infant formula, combined with kind of broken down proteins that are sort of this pre-digested early nature of breast milk to really be really well tolerated. And we believe, addressed one of the largest gaps between breast milk and formula, which is protein, which is kind of the superfood of breast milk. And so that really kind of approach really enabled us to actually prove out some major benefits in the largest clinical trial from a new brand in over 25 years. It was published in the Journal of Pediatric Gastroenterology and Nutrition and showed things like less spit up, softer stool, easier digestion, longer stretches between nighttime feeds, more efficient growth, more similar to that of breast milk. And so one study showing multi-system benefits, but importantly, we also own our farm to formula supply chain. So we could do it through cleanest ingredients. We were the first formula to use organic grass-fed whole milk, not skim, retaining those really important fats and enabling us to reduce the amount of seed oils in our formula. And we were able to also... Stop there for a second,
because we're just hearing, like, I'm not saying we are just hearing, but I think it's becoming more aware talking about, like, seed oils and what's going on. So, and I like that you bring this up. So these are core components, like, correct me if I'm wrong in understanding this because I don't have kids, but I think I just understood what your sister was going through when she was grabbing that milk off the shelf. But even things that we as adults are eating, and we're making these choices to change because we know it's not the right thing for us to be doing. So we're doing with our purchasing power. When you go to that shelf, you're like, oh, I can't find something that I want, so I have to make this trade-off because, for example, this one's going to have this ingredient that I know I won't even eat, that I'm trying to cut out of my diet, but I can't help it because that's what's on the shelf. Is that kind of where we're going? I want to make sure I understand that.
Yeah, you're right. There's I think, inspiring and major consumer shift, I think, over the last 5 to 10 years that, people don't want to wait to get sick anymore, right?
Yeah.
They're taking control of their health and wellness. They are largely understanding the importance that nutrition plays. It's sort of this food as health concept. Mm-hmm. We believe that needs to start in the first day of life. That is infant formula. What you eat in the first year of life really sets the foundation for future health. And so our approach has been always equally discerning in what we put in. For example, these critical proteins found in breast milk that drive these really important benefits. But as importantly, what we take out. So we were the first first kind of infant formula to prove these major benefits and be much easier digestion formula, but without corn syrup, without maltodextrin, without soy, without palm, things that you don't want in your own diet, much less your baby's.
The things we don't want to eat. Like, I don't want to eat that. Like,
Exactly. And look, and all infant formulas have seed oils to get closer to the kind of very important, fatty acid profile of breast milk. But by being the first formula to bring organic grass-fed whole milk to to the United States, we were actually able to use less of those seed oils because we're relying more on the natural fat that play a really important role in in baby's development. And so that was kind of a first in the country, and we've been pleased to see some others have followed suit thereafter. But we're always focused on trying to raise the bar in the category, and that's what we believe we've done with our first product.
Wow, what a great story. So what's next? I mean, talk to me, Ron. How does this continue to grow? Like, talk to me about how you continue to gain market share and build awareness.
Look, infant nutrition is overdue for innovation. Parents shouldn't have to settle for, outdated standards when the science has evolved so far. I think we're actually in a very exciting time in this industry with more focus on food and in actually infant formula than ever before. Actually, at ByHeart, we're really proud to be engaging directly with policymakers through what's called Operation Stork Speed, or HHS's specific infant formula initiative. And we're working with White House, USDA, HHS, FDA to strengthen really the U.S. supply chain and really raise the bar on quality and innovation. Operation Stork Speed is now doing the first nutritional review of infant formula standards in almost 30 years. Like, imagine every 5 years we review nutritional standards for adults, but we haven't done one for infants in 30 years. And, this is all we do at ByHeart since inception almost 10 years ago. Work with the experts in breast milk science, understand the latest kind of nutrition, bring together ecosystems of, passionate people within our companies that want to do better with the world's experts on every macronutrient across proteins and fats and carbs and prebiotics, and bring them together to do better. And so now we're excited to be in the conversation, sharing some of our perspectives on what can and should change in this industry, to really shift from a regulation that has said sort of here are the minimum and maximum requirements or the quantity of nutrients, but rather make a shift to actually focusing on the quality of the nutrients and more breast milk benchmarking. So, because babies deserve much more than just we're targeting growth. Like, of course, babies should grow. We should be looking to target really functional benefits. We also believe that, parents deserve really clear evidence-based labeling. Our philosophy has really been one where this should be a category where, if you haven't done a clinical trial, there should be no claim. Like, we should really create evidence. And, we hope that some of these shifts and some of this policy will actually reward companies that invest in original science and build supply chains here in the United States, so that one day this isn't a category with just 5 of us, manufacturing and innovating in infant formula, but rather, you have more companies building more manufacturing here in the U.S. so that we never experience an infant formula shortage like we did a few years ago. And also that there are more companies, investing in clinical research, discovery, more science to really create a more innovative and advancing category. So, our big picture, our goal is really to rebuild trust in this really fragile category by combining really like clinical rigor, cleaner recipes, supply chain resilience, so that parents can feel confident and supported, and so that the U.S. can really lead the future of infant nutrition as well.
Amazing. How can people learn more about ByHeart? How can they follow the journey, Ron?
So ByHeart's available nationwide. We're across almost 12,000 stores. You can find us at Target, Walmart, Whole Foods, Kroger, Publix, Amazon, so on. And starting this fall, actually, at samsclub.com. You can also order directly from us at byheart.com, where we offer subscriptions and resources for parents. And, of course, you can also stay connected across social media at ByHeart and sign up for emails. At the end of the day, we want to be more than a formula brand. We want to be, kind of a trusted partner for families on their feeding journeys and a resource in that way.
Fantastic. For everybody listening, just so you know, we'll definitely put some links in the show notes so you can just click on the links and head right on over and check it out. Speaking of the audience, if this is your first time with Mission Matters and you haven't done it yet, hit that subscribe or follow button. This is a daily show. Each and every day we're bringing you new content, new ideas, and hopefully new inspiration to help you along the way on your journey as well. So again, hit that subscribe or follow button. And again, Ron, thanks for coming on the show.
Thanks very much for having me.